At a time when the nation is unitedly combating COVID-19, the medical fraternity is at the forefront of this fight. They are putting their own lives at risk to save the lives of others. So how challenging are these times for the medical fraternity, and what do we as a nation and as individuals need to do to keep ourselves safe and healthy? To talk about all that and more, we have with us Director AIIMS Delhi, Dr. Randeep Guleria. We are at his residence on the AIIMS campus. Welcome, Dr. Guleria, to DD India.
Thank you.
I saw a placard on Twitter. It was held by a doctor and it read, "I stay at work for you, you stay at home for me." That's powerful messaging. On the day of the Janata curfew, we saw how the entire nation saluted the selfless service being rendered by health professionals. The Prime Minister, the Health Minister have underscored the dedication of people like you who are part of the health fraternity. Are these challenging times for the medical fraternity, and is it also an opportunity for you to learn and prepare for the future?
So both these are challenging times for the health fraternity, because this is a time when the health system is being challenged. The healthcare workers are at the front line about a disease that they are scared about, they don't know that much about it, and they are worried about their own lives and the lives of their dear ones. It's also something that is a process of learning, because this is an outbreak which is unprecedented in history, or in our lifetime at least, and preparing for it and preparing for the future, building up our health resources in a short span of time, and how do we cope in this moment of crisis is something that we're all learning every day.
India is currently in lockdown for 21 days. How crucial are these 21 days in this fight against COVID-19, and what's the logic behind 21 days per se?
So first of all, it's important to understand that this is a disease which is through human to human spread. What that means is that if we have to break the chain of transmission, we have to stop this human to human spread, and that means spreading from one individual to the other, which can occur only through social contact, coming closer, or being in a crowd where we have a large number of cases. If we are able to have a total lockdown and individuals stay at home and follow it sincerely, then this will stop. The virus has an incubation period of about 14 days, and if we allow 14 days of total lockdown and we give another week, so that in case there is someone who has a little bit of a prolonged incubation period, we will be able to prevent that transmission to another individual during that incubation period. Having said that, it's important to understand that as it goes from one person to the other person's incubation period would be for another 14 days. And that's why the duration of the lockdown may change or get extended after 21 days, depending on where we are on the curve. We must understand that actually by having the lockdown, we are not going to be able to totally eliminate the disease or eliminate coronavirus, but we will be able to bend the curve. In other words, if we don't do anything, the number of cases will rise sharply, we will have a huge peak, and this will cause a strain on the health system. If we are able to have a very aggressive lockdown, we may be able to limit the number of cases. The peak which is going up like this in US, in Italy, may become less, and the number of cases may become lesser and prolonged over some time, and the healthcare facility therefore will be able to manage with these cases. Our mortality will be less, our health resources would be optimally used. So this lockdown is of utmost importance as a measures to prevent transmission. But when I keep saying it's important for everyone to understand his responsibility and follow the lockdown sincerely. If they don't do that, then transmission chain will not be broken.
Where do we stand as of now in terms of community spread? How far do you think we are from stage 3, or are we in a grey zone? And any estimate in terms of numbers or percentages that what could happen after 21 days?
So currently I would say that we are in between the two stages, and the reason why I'm saying this is that if you look at the news or if you look at data coming from various health agencies, we do hear of few cases who've had no travel abroad, or who have had no apparent contact with a positive case and are positive, and they may have spread it to a few more individuals. So there is some sort of suspicion that they may be minor but early community spread, and that is why the lockdown becomes even more and more important. If we don't do this lockdown, like I said before, we will have a huge surge in the number of cases. And that is why it is more and more important for everyone to follow this lockdown.
We are at your home, we are following social distancing, all our crew members are following that. While staying at home, how do you follow social distancing? How do you keep your home disinfected, and do you maintain hand and respiratory hygiene?
So there are two or three very important things, and the important thing is to understand how does this virus spread. It's a droplet infection. If I have coronavirus and I cough, the droplets of my cough will carry the virus in the air. It cannot go very far, not more than a meter. So it will stay just for some time in the air, and if someone comes in very close contact with me and I am coughing, he can inhale the virus and it goes into his respiratory tract. The other more common way is surfaces. If I cough and the virus is in the air, after some time those droplets will settle on a surface. Also, if I am coughing and I don't use a handkerchief and I am not careful, I touch my nose and mouth, the virus will come to my hands, and any surface that I touch with my hands, if I don't clean my hands, I will transmit the virus to that surface. If I do that, then that virus can stay for a few hours on that surface, and anyone who touches that surface after me will get the virus on his hands, and if he touches his nose or mouth or face, the virus will reach his respiratory tract. So the important issue here is not only social distancing, but regular hand washing. So if you are outside and you come home, please wash your hands regularly, wash them properly. If you have surfaces which you feel people may have touched, use an antiseptic to clean them. Maintain good cleanliness in your house, and if you go out and every few hours, do wash your hands so that you don't carry the virus home and give it to others. So that is the most important message, and that is what each one at his residence or house should do. Some degree of social distancing, but I do agree that it's not possible for everyone in India to do it. We have people who live in just one small houses where there's just one room or one bedroom. But even if you can't have a very good social distancing, at least you can clean your surfaces, clean your doorknobs, and you can also wash your hands, and all the whole family member can wash their hands regularly. I would go ahead and say that you should make this a ritual, that everyone comes together like some sort of a social activity and washes their hands together, which will, and you can make a song out of it while you do it, so that it becomes an entertaining thing while you're sitting at home and doing nothing else. Wash your hands and do it in a sort of in a game manner or in a musical manner, but keep doing it regularly.
There's a lot of information that's flowing in social media on COVID-19. Not all of that is necessarily right or authentic. So would you like to address some of them, and we could do it in a rapid fire round, so to say. So like you said that, one can do this hand washing exercise in an entertaining manner. Prolonged home stays can take a toll on mental health. So how can these 21 days at home become 21 days of happiness?
So it's a very good question, and I would say that prolonged homestay can have effect both on physical health and as far as mental health is concerned. If you look at mental health, it's because you're staying at home in a closed environment. We're lucky at this point in time that we are living in a society where technology is there to a large extent, and if we have a lot of technology, we can still stay in contact with friends, with people who are not only in India but abroad, and stay in touch with them. We can see movies if we want, we can read books. I would say there are a lot of activities that one can do which one would have postponed because of the work, his work schedule and being busy. All of that we can actually take up and do right now. Regarding physical health, it's important that we have an exercise schedule. In India, we do a lot of yoga, so I think regularly we should have a schedule of doing yoga in the morning. People have made walking tracks in their house itself, and they would walk 10, 20 or 50 times in the morning, and that is also a good exercise.
Are there any differentiation that one can make between seasonal flu and COVID-19 symptoms?
So the differentiation is actually very difficult. Some people would argue that if you have dry cough, it is more for COVID-19. If you have running nose, it's more for flu. These are very subtle features. There is no real definite difference between the two. and that is why it becomes more and more challenging, because as you can see, the weather today is also overcast, it's cloudy. This is the type of weather where cold, common flu and a lot of viral infections actually become more, and therefore people worry that if I have a running nose, cold, do I have COVID-19? I would say that you should not worry. The chances in our country, if you have not come from abroad, if you have not come in close contact with a positive case, currently are very, very low. Just stay at home, just take your cold medicines and rest, and you will be all right. Don't panic.
If I knowingly or unknowingly come in contact with, say, a COVID-19 positive case, what should I do?
So, if you have come in contact with a COVID-19 positive case, knowingly or unknowingly, stay at home, quarantine yourself for 14 days. Don't become part of the chain of spreading the disease, not only to society but to your near and dear ones. Regularly wash your hands, use cough etiquettes, cover your cough. If you don't have a tissue or a handkerchief, cough into your armpit. If you have a tissue, cough into the tissue and dispose it properly. And try and maintain social distance, or at least a distance of 1 meter, especially from children or elderly or people who have comorbid conditions like diabetes, hypertension, heart or respiratory diseases. Let me again say that even if you get infected with COVID-19, there is a more than 80% chance that you will only have a mild illness and you will recover without any problem, because in majority of individuals, more than 80% of individuals, it's like a common flu and cold and people recover from it. It's only around 15 to 20% of people who get COVID-19 who need to be admitted, and of those it's around 10 to 15 or 20% who actually need to go to the ICU, and those are elderly, those with comorbidities. So, in younger people actually the disease tends to be much more milder, and it is not associated with higher mortality or morbidity.
Who can wear masks, and can these masks be made at home and used?
So, I would say everyone doesn't need to wear a mask. If you're normal, healthy, no cough, no need to wear a mask. You should actually just be careful about going to crowded areas, and like I said, stay at home, wash your hands. Healthcare workers need to wear a mask. If you are working in various other places where there is a chance of coming in close contact, you can wear a mask. And you have the 3-layered surgical mask, you have the N95 mask. The N95 mask is required only in areas where actually in close contact with COVID positive patients. So, everyone does not need to wear N95 mask. We are actually misusing the masks, and we will run out of these masks, and healthcare workers who actually need these masks to protect themselves will not be able to get them. The other important thing to remember is that you can make masks out of clothes, and if you are very worried, you can wear them even if it gives you a sense of security, but it is not really required.
There are emergency service providers who are stepping out of their homes and providing services, health professionals being one of those emergency service provider categories. There are also journalists, there are drivers, there are sanitation workers, among others. Any safeguards that they should follow?
So, again same thing, social distancing. There are people who have to go outside because they are part of the team which has to provide support, whether it be electricity, sanitation, healthcare workers or policemen, or the media people for that point of view. My advice is, again, wash your hands regularly, maintain social distancing, and be careful. If someone has cough and cold or fever and he is in this group, he should stay at home and not go to work.
Have any instances come to the fore of people showing no symptoms at all and just being carriers of infection?
So, there are now reports of mild asymptomatic individuals who can have this symptoms, but they are very few, and therefore, the chance of transmission in that group is less. But yes, you can have very mild symptoms which you will ignore, and you may still have the infection and may be able to transfer it to other people.
Reports have come to the fore, Dr. Guleria, of how health workers in India have contracted the virus. Then you see pictures of Italian nurses, doctors and paramedics on social media with bruised faces because of the long hours for which they wear personal protective equipment. What precautions are health workers in India taking or should take in these testing times?
So, my advice is, and we are doing that in our hospital, all healthcare workers, and I say all because you don't know when you will be called to do COVID duty, should get good training in infection control measures, whether it be wearing a PPE, whether it be wearing washing your hands, protecting yourselves, because all of us or many healthcare workers have not been trained in good personal protection equipment management, infection control management. This is an infectious disease. So, if you are suddenly the frontline warriors in this battle, you have to have good measures to protect yourself.
Well, as you can see, the weather is overcast, it's drizzling already, so it's the right time to take a breather. We'll be back. We are in conversation with AIIMS Director Delhi, Dr. Randeep Guleria, on COVID-19.
We bring to you a panel of doctors who will bust all the myths and doubts on COVID-19. In this hour-long program, you can ask questions from our panelists.
We have to make sure that all of us stay at home. It is very important that we make contact with other people as minimum as possible.
Follow this hand hygiene practice each time you go and wash your hands, and soap and water is the best.
You have traveled to outside for 14 days to the affected countries, or you have been in contact with a patient of COVID-19 proven case, then only you may require test, otherwise you don't have to.
Welcome back. We are in conversation with the Director of the All India Institute of Medical Sciences in Delhi, Dr. Randeep Guleria. We are at his residence on the AIIMS campus discussing with him the outbreak of COVID-19 and its implications for India. Dr. Guleria, it's raining, we can see. Any link that is there between the life of the virus and temperatures? Also, does gargling with warm water or drinking warm water or keeping yourself warm help prevent the infection?
So first of all, there has been a lot of interest because a lot of viral infections have what we call seasonality. Influenza is one viral infection which has the seasonality. In India, it's more during the winter months and during the monsoon months. But for coronavirus in general, that has not been observed, and this is a novel virus for which no inherent immunity is present in the community. Therefore, as of now, it's difficult to say that there will be any seasonal variation or the weather will make a big difference. As far as gargling is concerned, there is really no role in terms of it decreasing the virus. The virus gets into the cells or gets into the cells in the throat. So even if you gargle outside, it's not going to kill the intracellular, the virus that's inside the cell. So garglings really don't help. People try a lot of what I would say is local means to protect themselves. Some of them are to improve your immunity, and they may help, but there's no real data to support it.
Before going into the break, you had spoken about how it is important for health workers to be trained into how to tackle COVID-19 patients and keep themselves safe. I understand that AIIMS is playing a central role, not just in testing samples and treating patients, but also in capacity building and training. Tell us about your role.
We have looked at it from not only our own institute point of view, but from a national point of view. So in terms of training, we've started what we call regular webinars for all doctors in the government sector, in the private sector, on how to manage patients with COVID-19, what COVID-19 is all about. We've made, so this is for doctors, we've made a lot of video clips on hand washing, how to wear a PPE, how to take a PPE off, other measures like social distancing, that can be done, that should be followed by the lay public. So for them, we made some small video clips to put up on our on our website, also for the Ministry of Health and Family Welfare. We are also launching a central portal, which is basically for COVID-19 technical team of specialists who will be able to help doctors in different areas if they have problem in managing these patients. So this is a central line where a doctor can consult the specialist through a phone, through video conferencing, through WhatsApp, and this is linked to will be linked to all the medical colleges, the medical colleges, the government medical colleges in the country. This will be one common number, which will have multiple links, and anyone can ring up and consult a specialist regarding management of COVID-19.
AIIMS Jhajjar is now exclusively dedicated to COVID-19, and various states are coming up with dedicated hospitals after such directives were given by the centre. Will this reduce the patient burden on other hospitals like maybe yours?
It will. We have also come out with another plan. If we have a huge number of cases, the trauma center will be converted to a COVID hospital with the burns and plastic surgery center, which is partially ready, becoming a triage area, and the ICUs there will also be COVID ICUs. So that plan is also in place. In case we have a need, and in our Mayor campus, we will convert that into a COVID hospital and shift all our traumas to the main hospital.
AIIMS OPD services have been closed for now. What can the patients who've already taken appointments or those who need consultation do at this stage?
So again, that is a good question. This is another thing that we're working on, and what we have decided is a mechanism of what we call Tele Consultation or e-consultation. So yesterday only we rolled this out. Yesterday our Department of Neurology looked at all the patients who had taken an appointment and their contact numbers, and they could call them up and provided a consultation to them through phone, and each department is being given a dedicated phone, and we will either contact our patients or we will put the number out on our website, so that if you have an appointment or if you are an old patient of the All India Institute of Medical Sciences and you want to consult a doctor in a particular department, you could do that, and by using that phone you would be able to advise you. Because you should understand, although we are making arrangements for COVID-19, non-COVID-19 healthcare should not suffer also, and that includes follow-up patients, but that also includes patients who have an acute problem. We cannot ignore a patient who comes with a heart attack to the casualty, or a person who comes with stroke, or a person who has respiratory difficulty which is not COVID related. They also need to be cared for.
Instances have come to the fore of discrimination being faced by health professionals, with landlords evicting many nurses, doctors and paramedics, accusing them of being carriers of infection to their homes. After that, we saw the Prime Minister warning of strict action against such offenders, and there is a medical cover that has just recently been announced for 3 months of 50 lakh rupees. Is all this reassuring?
It is reassuring, but I would still appeal to the public, and I'll say this, that just clapping your hands on Sunday was not enough. Our healthcare workers are actually putting their lives at stake for you. They're willing to work 24/7 for the patient care. That's why we joined this profession. But at the same time, the discrimination that they're facing is very, very worrying. There are students who come to me who are staying outside, that the landlord is not allowing them inside. One student came and told me that landlord has actually locked the lift because he's worried that if I touch the lift, I will give the infection, so I have to climb 5 floors every day because I'm not being allowed to use the lift. And you already have mentioned stories of people not being allowed inside there by the colony. So one nursing staff said that the RWA didn't allow them inside the colony. I can't understand that. That person is helping out, and he should be cheered by the colony rather than not being allowed into a colony because he's working in a hospital. But unfortunately, the panic that has been created is so much, and people are not knowledgeable that this is not a disease which spreads like this.
Well, that realization, like you said, urgently needs to set in. Now, India is a country that has a large population and limited resources, yet we've maintained an edge to begin with in terms of containment measures. How can India maintain that lead compared to developed countries that were caught in this quagmire?
So I think India had one advantage, that we had time to prepare, and we still have some time in preparing our health facilities, our resources, and at the same time being able to see what we can do as far as preparedness is concerned. The second thing that we need to do now is testing. We need to upscale our testing, test a larger number of people so that we don't miss out on community spread, and be able to say that yes, the disease is not there significantly, or if we have a disease in certain area, then be able to strictly have a lockdown there so that it doesn't spread to other parts of the country. And at the same time, provide adequate infrastructure so that our healthcare facilities are ready to take an increasing surge of patients if that happens.
In terms of testing, we know that indiscriminate testing is not taking place at this point in time. The testing criteria has been expanded. Private labs are also testing other than government labs. The government says it has a testing capacity weekly of 50,000 to 70,000 tests. Does that need to change, expand it further, a relook needed there?
So it's an evolving strategy. Currently, the strategy is based on what is the need. We started off with looking at people coming from outside and their close contacts, and testing was done for them. Then the testing has expanded to people who have severe acute respiratory infection and who are admitted in the hospital, and healthcare workers. Gradually, I think the testing will further expand to pick up any community spread if that may be happening. So that is the other thing that we need to do, and gradually this will happen over a period of time. The issue is One is diagnosis of patients who have COVID-19, the other is answering questions. And the most important question that I think testing will give us, if we do it in terms of surveillance testing, is how long should the lockdown stay? And that depends what is the spread among people in the community, and if that spread is significant, then the lockdown may have to stay on for a longer period of time. On the other hand, if by testing we come to know that the cases actually have come down, there is now minimal or no community spread, then we could actually consider a graded decrease in the lockdown.
Absolutely. This ringing of bells that we can hear in the background reminds me of the 5-minute 5 p.m. applause that was there for people like you. There is a lot of interest worldwide in a drug called hydroxychloroquine. Donald Trump has called it a game changer. Who can use it?
It's still an experimental drug. The data for its use is limited. A lot of data is based on what I call in vitro data, cell culture data, animal studies. There is only one small study from France which looked at moderate to sick patients and showed that it was useful. So we have limited data as far as it's concerned. However, we have nothing else to offer, and because of that, after a lot of deliberations, the government decided that we should look at two categories. One is healthcare workers who are treating COVID patients, because as we've been saying repeatedly, they are in the front line and they're at risk. And if we can provide some drug which is safe and may be effective, let me put this in a may be effective, it's worth taking that risk. Secondly is close contacts of COVID positive patients, because as you see, even in our country, the maximum number of cases are either those who have come from outside or their close contacts. So they also, if we can sort of provide some treatment to them, we may be able to break the chain of spread as far as COVID-19 is concerned. But currently there is not enough data to say that this can be widely used, and like any other drug, this drug also has side effects.
So it can't be used as an over-the-counter drug?
It cannot be used as an over-the-counter. It has side effects which can be cardiac, and therefore if someone has an underlying heart problem, we have to be careful about using it. And if we are using it in healthy people, we have to be careful that we don't do more harm than good. If we are using it in sick people, we have to be careful that this works and it's not causing more side effects which can have an effect on the overall outcome.
Where does the world stand in terms of R&D for vaccine? Any indigenous leads that India may have made in this sphere?
So the world is working as one in developing vaccines. A number of trials are ongoing, number of vaccines are being tried. India has isolated the virus, and there are interest in Indian vaccine manufacturers to see whether they can develop a vaccine. The important thing to remember is it will take some time. Whenever you are developing a vaccine, first of all you develop a vaccine. Then you see whether this vaccine is effective or not, is efficacious. There is no point having a vaccine which works only, has an efficacy of 10 to 20%. You need a vaccine which is at least 70 to 80% effective. Then the vaccine has to be safe. Safety studies have to be done. The vaccine itself should not cause harm. You will be giving it to people who are not that symptomatic. And then at the end of the day, you have to produce it in large amounts. So mass production. So if you look at all of this, it will take, in my mind, at least 1 year for us to get a good vaccine in the market, going through stages of efficacy, safety and mass production.
AIIMS, known for its research capabilities, does it plan to do any R&D or documentation on COVID-19?
So AIIMS has already started, and we as a research institute have called for proposals. We are looking at various studies. It could be looking at rapid point of care test. Can we have a rapid test which is being used abroad in China and Korea? How useful is it to diagnose infection in less than an hour by using just a drop of blood? Can we look at various strategies which tell us what is happening in the body in terms of inflammatory markers, cytokines, and then drug trials? Can we look at drug trials and then vaccine trials? So AIIMS has already started various research protocols and rolling them out.
You work all 7 days a week like most health professionals do. How do you unwind, especially during these testing times, and what would you suggest to your colleagues?
So I would suggest that this is a time of stress. So we need to do things to de-stress ourselves. It could be meditation, it could be yoga, it could be spending more time with the family, and that's easier to do now because everyone is at home, and also trying to do things that you like, I like to read books, so you could spend time reading a novel or a book. But currently it's a very trying time, not getting any time to do any of these things.
Well, thank you, Dr. Guleria. It was a pleasure to have
Thank
you
you
on
very
DD
much.
India.
Thank you.